Hi, folks. This is What's New Westford, the podcast where we talk about what's happening here in Westford. I'm Steve from WestfordCAT, here with our remote correspondent, Alex Svenson, who is new to our news team and has been covering local government issues at both the local and state level. Alex is a journalism student at Suffolk University. Thanks for coming on, Alex. We're happy to have you here. And
Thank
our
you for
other
having me.
our other guest today is Kristi Bates, the president of our board of directors here at the station. Welcome to the show.
Thanks, Steve. Hi, Alex.
Nick Woodbury is once again running the technical end of our show. The stories on today's rundown are a bill to address the opioid crisis, a change in state districts, and a spike in COVID detected in Boston's wastewater. Links will be in the description as always, and feel free to tell us what you think about these stories in the comments. So, Alex, what's new in Westford?
Hi, Steve. Thank you for having me. So, there's a lot going on right now, both in the local level in Westford, also in the state level. So, I'm currently based out of Boston. So, one asset I have, or one major asset I give WestfordCAT is that I can report on what's going on in the State House, and that includes what's being passed by State Representative James Arciero. So, a bill that was recently proposed to the House by Representative Arciero was House Bill 2219. And this bill would essentially introduce non-opioid alternatives in pain treatment in an attempt to curb Massachusetts' ongoing opioid crisis. So essentially, what Arciero proposes is basically not is that he wants healthcare providers and hospitals to propose all available non-opioid alternatives to patients seeking pain treatment and pain medication. So this could include medicinal marijuana. Um, this can include a variety of other substances, legal substances that have been state regulated and that are an alternative to opioids. So like the opioid crisis has become a nationwide epidemic rather. And Massachusetts is one of the states that has struggled more with it in recent years, especially areas like the Merrimack Valley, so areas near Westford, such as Lowell. Um, Although it has gotten better in recent years, it's still a problem with many residents across the Bay State. And this bill essentially would help keep these dangerous opioids because they're very strong, so people can easily get addicted to them. They would help kind of keep the level of consumption down so people can kind of hopefully one day curb their addiction. So.
Yeah, well, it's great to be getting some alternative treatments in there. It's good that finally medical marijuana is being recognized for those uses. I had a friend who went to Boy Scout camp with me several years ago. We were on staff together, and he died of an overdose. Oh, I don't even remember how long it was. It's been several years now, and it's good that we're doing stuff to address this problem because it's not going away.
Yeah, I'm sorry for your loss, by the way. Um, it's a very huge problem all over the place. I guarantee almost everybody knows somebody who's been affected by this.
Yep.
And that's one thing that Arciero mentioned in his testimony that he presented to the House, is he said, "I don't have to tell you the devastating impact that the use of opioids has had on our nation and our state in the last 2 decades. Addiction and death have become all too common, and these very dangerous drugs have gone from our hospitals and doctors' offices to our streets and vulnerable populations." So what he's essentially saying here is that a lot of people, because they're prescription medications, a lot of people are trusting their doctor. So doctors are obviously amongst the most trusted people. So a lot of people take the prescription, and then it only becomes a matter of time before they start abusing it and they become reliant on it due to it's a whole psychoactive thing. That's a whole nother story.
Mm-hmm.
So they become addicted and they basically become hooked on opioids. And then from there, prescription. So a common prescription one is Oxycontin, of course. So people have been prescribed that for cancer treatment, chemo, and many other pain treatment. Um, that's something that can kind of very easily be addictive rather. And from that, there's been people who've even gone to other illicit substances like heroin.
Yeah, well, and if
So
your doctor's not
yeah,
going to fill your prescription for as much OxyContin as you think you need, then that's kind of the next logical step. If you think you need more, it's looking to street drugs, and that's that's a whole different ball game of risks and you know, you could get impure product. Um, you could get something with fentanyl in it that you don't know. You never really know what you're getting off the street.
yeah, it's quite unfortunate, Steve, that how it's kind of spiraled out of control.
Mm-hmm.
Um, because like I said, people it starts off as something that people just use to cope with their pain. And of course, like these kind of conditions that people are suffering, you need something to cope with your pain. So it becomes it kind of spirals out of control into the sense where their whole lives just depend on it. And essentially, this bill is just basically enforce that hospitals tell them all possible methods, not try and favor one or promote one. Just basically let them know all the information that's available and up to dates and with science the scientists, and allow them to make their own choice.
So I think this is a great bill. I was really excited to read your article, Alex. I had a direct experience. It's a small story, but it's about 6 years ago. I was at a Girl Scout camp and had a scratch on my eye, scratched cornea, and suffered throughout the night. Ended up the next morning, my husband brought me over to Lowell General Hospital and to the ER. Doctor saw me, uh, confirmed it was a scratched cornea, and immediately issued a prescription for it was either OxyContin or Percocet. And I immediately, knowing what's going on, I didn't want that. Their other
Mm-hmm.
option was sort of a lower level medication. I don't remember, but I had to ask for it. Ended up going home, was still in a lot of pain. Ended up going to my eye doctor, and she put on a clear contact, and the pain was almost immediately relieved. And she also said, "Huh, I wonder why the hospital didn't contact me. I was on standby, and they never reached out to her." So I was, having experienced that, was especially happy to hear that this would be presented to hospitals and doctors so that they can give all the alternatives, including medical marijuana. I mean, my story is a scratched cornea, and obviously there's a lot more pain issues out there. But I've had given birth to 2 kids, and that scratched cornea was more painful.
Wow.
Most painful, most pain I've been through.
And that's remarkable that it didn't even take drugs. It was just the
Yep, it was a clear contact lens. That was an option which they had available to them, and they opted not to call the doctor that they had on call. So this is so to have this bill go through and know that just in my small scenario, they would have to go through the other options besides giving me or the patient an opioid. I think that's great, and not starting us on that journey towards addiction.
yeah, well, and you know that's crazy for that to be available and for that to not be kind of one of the first things that they might go to.
Yep.
The going straight to the opioids seems like we don't have to get too much into Purdue Pharma and their influence, but you know they are being held responsible for pushing too hard, and I
Mm-hmm.
wonder if maybe there's some connection there that the doctors were hanging out with their Purdue rep and really wanted to make that money.
I have no idea, but I will say I was surprised at the time because this had already been in the news. This was still an issue. So I was surprised that for that, it was immediate, go right to the opioids.
Interesting.
Yeah.
Yeah, unfortunately, as you mentioned, Steve, I mean, this is a whole other issue, but the big pharma contributes a lot to promoting opioids and promoting the usage of them at hospitals. And they're often also the ones to lobby against legalization of medicinal marijuana
Mm-hmm.
because they want to keep them in business. They want to keep opioids in hospitals. So that's has a lot to do with it. And it's actually mentioned um, I believe in the bill actually, as kind of a way to curb just opioids and basically prescription medicine to always be the number one, and all alternatives never being suggested by doctors, because that is usually often the ones that they want to suggest.
Let's move on to our next story, which we have redistricting, and this is I just have to warn viewers. There's two different efforts going on here, and one is called redistricting, the other is called reprecincting, and it's easy to confuse the two. So the reprecincting we've talked about a little bit on previous episodes, and that is in Westford, your voting districts are changing, and that is completely separate from the redistricting that we're talking to right now. Even though in that episode, I think I incorrectly used the word redistricting to describe the reprecincting. This is specifically about the redistricting, and that is at the state level. So, Alex, tell us what's going on there.
Yeah, so essentially, there's been ongoing efforts to create new districts in Massachusetts that is on the congressional level. And because a lot of communities in Massachusetts, the residents, they feel misrepresented, and they feel like there's a lot of communities that are pushed together in one district that don't fall into the same category what socioeconomically and politically in Massachusetts. So basically, Baker recently signed new legislation that came into effect, I believe, like 2 weeks ago now, and it basically it kind of prevents combining wealthy suburbs with lower income cities, which they thought did a great injustice to the people of those communities. And they also believe that it would kind of balance out the population of each of them, each of the districts. They're hoping to have about 781,000 per district now. So, and it would also increase the number of districts with a majority of minority residents from 20 to 33. So they believe that'll help strengthen the political representation of minority voters in the Bay State. So one of the major supporters of this was, again, Representative Arciero. He was basically favored the bill ever since it was first created. The majority of state representatives in Massachusetts also supported the bill. There was not many who were against it. So it was passed with not a lot of debate. So
Very good. And I believe Westford was one of the towns that got moved from one district to another. So I think was it Senator Ed Kennedy or was it Senator
Yep.
or
Representative? State Senator Ed Kennedy.
And we have been moved out of his district, and we're now in a district with, I think, Acton and some of the towns to the
It's actually not Acton. I looked. It's District 10, I believe, and it's not Acton. We are actually the farthest. Westford will be the farthest town, the farthest east, and so it's going out to Lunenburg. I can't remember.
Littleton, right?
No, I don't think Littleton's in there.
Oh, okay.
Fitchburg. Again, it's on the map. You can take a look at.
Oh, it's the Fitchburg district.
Yeah. But,
okay.
So
okay.
I reached out. Actually, I was very interested in the article, and I was reaching out to, and sad that we're going to lose Ed Kennedy, because Senator Kennedy's been, this, as far as the WestfordCAT station is concerned, he's been very supportive of community access television, and done, he's been here for interviews and very supportive. So it looks like when he's going to be here, it's not going into effect until 2023.
Mm-hmm.
But then we will get a new state senator, and I believe it's John Cronin. I couldn't find it anywhere online, and I called Senator Kennedy's office, and that's who they said it was. So I am curious to know how being in this new district is going to impact Westford. We won't know it till it happens, but
yeah, for sure.
Well, and Ed Kennedy has definitely been an ally to public access, and hopefully that will continue without our influence. So maybe this is an opportunity to maybe spread some influence in a new direction, and
exactly.
Hopefully get a few more politicians on board with keeping public access alive.
Right, definitely. I was again doing just a little research, and I saw that Secretary of State Galvin was not in favor of this bill at all.
Interesting.
And there's an article on Boston.com that talks about that, but he felt it was a great disservice to a lot of communities, that I guess some communities were being split up, so towns were being split up, or they wouldn't. I mean, I think Groton is one of those towns. It wasn't in the article specifically, but Groton, I think, is now 2 or 3 districts.
Oh, wow.
Yeah, I believe so.
Which is, Chelmsford has been like that for a while. Like Jim Arcero, one of his, I don't know if the state rep is changing. I don't think so. Westford we're going to still have Jim, but I think he only has a small segment of Chelmsford right now, and I'm not sure if that's changing. Very interesting.
Yes, I used to work for 4 years for Secretary Galvin, Um,
Ah,
but yeah, earlier in my college years. So
yeah.
I I can understand why he would be opposed to it. Just because it makes it kind of more difficult at this higher level of state government. But at the same time, I also see why a lot of people would support the bill because I think it favors, like I said, it kind of groups communities more into similar communities than before. So I could see why that would be very popular amongst specifically communities that feel underrepresented.
Yeah. Well, and our current district includes Lowell, and like how much really is there in common between Westford and Lowell? That's kind of far ends of the spectrum. They're
Yeah.
they're very urban,
Yeah,
and we're very kind of almost rural, more suburban.
yeah,
But yeah, certainly in terms of socioeconomics and demographics, I can see how you might want to split those up and put Westford with some of the more like communities.
And Alex, quick question: why do you think that it's more difficult at the higher government levels with this new plan?
more so that it changes a lot. They have to kind of readapt because the secretary is the one who's like in charge of all the districts and voting. They're in charge of all that.
I
So
see.
it just kind of makes it a little difficult for them. And they also, I believe, I forget exactly what Galvin said. I read the article, but I think he also trying to here. I'll look it up actually, where he specifically said had to do with something about incumbents running against each other.
That's right. That this prevented incumbents from running
Yeah,
against each other. Yeah, yeah. So just,
exactly.
I mean, redistricting, just like with re-precincting Westford, it's a lot of work.
Yep.
Whatever it ends up looking like once you change it, it's just a lot of work for a lot of people.
Absolutely. And it's important that it all comes out fair. We don't want to have gerrymandered districts. And I do believe there was um, a line in the article that I read saying that this was everybody thinks that this is a fair breakdown.
Yeah,
So that's definitely something to keep an eye on. It looks like we're all good.
And since you said the word gerrymandering,
Oh boy.
and since I just looked it up, do you know where gerrymandering comes from? Not a quiz, but
Oh, Jerry was
I do.
a guy, I think.
yeah, in Massachusetts. Alex, you look like you know.
Yeah, I believe was he a representative or a senator? I'm not sure exactly
He
where, but
signed the Declaration of Independence. I forget exactly where he was. Yeah, go ahead.
yeah, it was, I don't know the full story. I just knew it
Yep,
came from a politician.
yep. And so I know people out there can Google it, but his first name was Jerry,
Hmm.
and it was Massachusetts. And so the gerrymandering was when they in the state of Massachusetts, he pushed to create these unusual looking voting districts, and so it was named after Jerry.
Yeah,
Thought that
Hmm.
was interesting.
Yeah, no, I haven't read that story in a while, but yeah, it's an interesting tale of politics from a different era that is
no,
still
it is.
relevant.
I believe, yeah, and I believe gerrymandering tends to be more common in swing states as well,
Hmm.
just because who's at the government who's in charge is kind of tries to alter the districts to favor them because they know it's more competitive.
Yep,
So I believe it's something you see more in places like New Hampshire than Massachusetts. But
yep,
Makes
that's
sense.
believable. Thanks for listening. Before we continue, I have a couple of quick announcements. The annual Charlie Brown Christmas concert at the PCA is back in person this year, hopefully, performed by Aidan Scrimgower and friends. There will be 2 performances this year, with the first on Saturday, December 18th at 7:30, and a family-friendly show on Sunday the 19th at 4. Visit westford.com/PCA for more information. Last year's concert was broadcast to a virtual audience by me, and if you can't make it to this year's event, you can go check out that recording on WestfordCAT's YouTube channel. I have to say, those guys do a fantastic job at capturing the original Charlie Brown and just performing it so well. Now we're going to take a quick break and come back for more after a word from our station.
WestfordCAT is more than just television. We have the equipment and knowledge to help you get started as an independent media creator. Find us on YouTube for local news, Westford Academy sports, and media content created by Westford neighbors and friends. or look up our website at westfordcat.org for details about the station and how to get involved. Funding for local media is on the decline, so if you appreciate our work, please become a member of the station or make a tax-deductible donation to support local media. Links are in the description. Thanks for tuning in.
We're back with more news and discussion. Just a quick reminder, links to these stories are in the description if you want more information. And don't be afraid to leave a comment telling us what you think about any of these articles. All right, let's move on to our third topic, which is a spike detected in COVID. A spike in COVID detected in Boston's wastewater. And this is it's a metric that I'd forgotten that they were following, that they measure the amount of COVID that shows up in your wastewater coming out of your toilet and your shower, and that's a way to measure the amount of COVID in the whole population, kind of at a broad survey, and it's a really interesting way to approach it. So Alex, what's going on there?
Yeah, so it's kind of a strange new study. It's that they've been having, Steve. It's like a relatively new discoveries. They've been able to measure the traces of COVID-19 in wastewater. So this began in Boston, but it's becoming applied all over the Bay State, all over Massachusetts. So they basically they can detect the levels of COVID-19 in wastewater, and they basically, when they see a higher rate, when they detect a higher rate in the wastewater, they can kind of almost use that to predict that there's going to be an upward trend, an increase in COVID positive. So the more they see it in the wastewater, the more positive cases that they mean. So there's a lot of worries that with the new Omicron variant, that because they've been seeing increase in the wastewater, that there will be an increase in positive cases. So they even spoke with a specialist at Boston University in infectious diseases. They basically said, he was like, this is worrisome because the wastewater data closely mirrors community transmission rates, and all the indicators are not good right now. So, and then someone else, Todd Ellerin, who was director of infectious diseases at South Shore Health, also said the wastewater is predictive, and when it's going up like this, you expect a significant surge in cases. And then in the weeks to follow, you'll see an increase in hospitalizations and an increase in deaths. So, not to try and scare anybody, but this is just what the experts say. They think that because it's going up in the wastewater, it means we're going to see a spike in cases.
Well, and indeed, I've been following the WCVB tracker with their graph of total infections per day, and in the last couple weeks, there has been just an absolutely massive spike in the number of cases. We were, I think, 2 months ago, we were below 2,000 cases a day, and we're now over 4,000 on average. And that's the average. The spike in cases on one of the days was up around, I think, 6,000 on one day. That's a lot. It really, if you compare the graph of the last month to the graph of last winter, they are very similar. And well, that's concerning.
It is concerning. I'm feeling that just this afternoon before I came over here, I've got my 2 kids are in high school, and they both asked, because we were talking about those high numbers, and they said, "Are we going remote? Are schools going remote again?" So I think people have these concerns, and the numbers are going up. I was invited to a holiday party on Sunday, which I haven't been invited, haven't gone to in a couple of years, and was excited about going. We're all vaccinated. Let's meet. And then a friend of the person hosting the party, who's been in her home, tested positive for COVID.
Oh, fun.
So kind of putting that on hold now.
Yep.
But it's interesting about the wastewater. I was talking to my husband about this, and he said, well, if they're testing in Boston, isn't that where all the hospitals are? And the COVID patients tend to be, he guesses, in the Boston hospitals. Would that impact the COVID numbers in the wastewater? Like, I would think everything would be relevant, but I thought that was an interesting observation.
Yeah, interesting.
Yeah, I'm sure that could play a role into it. However, I know Boston is on a water, what's the word? Like a water treatment plant for Boston. It's all one big system. Like I mentioned before we started recording, the Quabbin system.
Yeah.
So it doesn't just account for Boston's wastewater; it accounts for many other communities, neighboring Boston's wastewater. So it could play a role in it, a factor, but I don't know if it plays a significant factor because there's many other communities that have had low COVID-19 rates, that also their wastewater is factoring in there as well.
Yeah, well, and just with the sample size being so large, I could see how the cases from a hospital would just be a drop in the bucket compared to
True.
everything else from the whole community. And also, if you think about it, like if you live in Southie and you get COVID and you go to the hospital, like your wastewater is still going to the same location, whether you're at home or at the hospital.
Yep.
But yeah, it's an interesting question.
Yeah.
I think this is such a new thing that I think there are a lot of interesting questions like that to be asked and explored.
And that's something that I don't think they could test for in Westford because, Alex, as you pointed out, we have groundwater and
Yeah.
we also are on septic. So there's
Exactly.
no water.
And
to
that's like
test.
something I would like to see actually is because Westford gets their water from Merrimack River Basin. So like that area, I'd like to see them test that because I believe that's also where like Lowell, Chelmsford get their water from.
Yep.
So I'd like to see the differences in that with Boston's because I know also Lowell and Lawrence, which are both on the Merrimack River, were high epicenters, at least for Massachusetts standards, of COVID for a long time. So I wonder if that would change at all the rate because you have a good point. What if some communities have higher rates of COVID-19 than others? That could create skewed data. So I'd like to see the Westford area water systems data in comparison.
Right. And I think I just read today, although don't quote me on it, is that Westford's positivity rate is now higher than the state's average.
Oh, I hadn't seen that.
So confirm it, but yeah.
Yeah, time to lay low. Well, the good news this year as compared to last year is that last year at this time we didn't have the vaccine. This year, I think the rates of vaccine in Massachusetts have been pretty good compared to the rest of the country.
Yeah, I believe they're the
That's true.
highest in the country, and they're higher than some other countries as well. It's around almost 70%, I believe. But a lot of specialists, a lot of scientists and researchers think that the vaccine that people have received already, the 2 doses, might actually be kind of wearing off a bit, and that's why we're seeing a spike. And that's why they're trying to advise people get the booster. So, especially people who are more at risk.
Yep. And I was just talking to my mom about the booster earlier today, and she was saying that uh, she had read some study or some article that was saying that if you got the shot from Moderna, then getting the booster from Pfizer and kind of cross-pollinating between the two would increase your overall level of protection as opposed to just getting one. Both are getting your booster from the same as you got your original vaccination. I don't have any verification to know whether that is true or not, but it seems like it would make sense if they're both kind of made in slightly different ways and targeting different bits of the virus. Then maybe overlapping the two does give you better protection. But I'd like to see some more data on that.
Yeah, because I've also heard the original reason why they wanted you to get two of the same was that they said two of different ones wouldn't help as much. It would actually just make it not work as well. So I don't know. I'd have to also see.
Lots of research still to be done. You probably heard they just authorized boosters for 17 and 18-year-olds. 16 and 17-year-olds. I have a child in that category. So good to know. But they're only authorized for Pfizer. So this issue, they don't have a choice. Their booster has to be Pfizer for that age range.
Yep. Well, it's good that we're getting the kids approved because that was a big part of the issue this spring. Is a lot of people, a lot of adults were vaccinated, but we still had not much vaccine for the kids. I don't think it was approved in the spring, and so there were a lot of concerns with the kids going to school.
And I just this is a little off topic, but I just read that Salem, Massachusetts is looking into having a vaccination mandate, which is something that New York City is doing, so that it would apply to any public space that you'd have to show vaccination to go to Market Basket.
Mm.
That'll be interesting. That's
Yeah.
not happening here. This is something that they're just talking about doing now in Salem, in one city in Massachusetts. But I thought it was
Yeah, I could see
interesting.
that stirring up the hive.
Oh,
Yeah, I could imagine that would be controversial because I actually know that's something that's happening on a larger scale, like in other countries. So I have
Yeah.
friends and family in Europe, and a lot of places there are requiring that you even need it to go into restaurants, bars, stores. You either need to present a negative test, like a recently taken one, rapid test, or get the vaccination and prove they have the card. And that causes a whole new array of problems like fake vaccine cards
right.
or people not denied entry to certain places because they don't have it. So
Right.
Yeah, and then that generates your backlash against having to present your government papers at checkpoints, and that will draw some comparisons to historically unfortunate situations. But yeah, I mean, it's a big open question at this point. Is it necessary? Is it effective? So we're gonna have to keep an eye on Salem.
yeah, I wonder how it'll work in Westford. I wonder if there will be remote learning in the spring because I believe when I previously did research and wrote an article on the school board meeting, the James Antonelli, the principal from Westford Academy, he said that COVID-19 vaccination records were just over 50% in the school, I believe. So that's just people who showed him records. That's not even overall vaccination rate. So I
Yeah.
wonder if the majority of the school were vaccinated, if that would play a factor. Because part of the where I go to school in Boston, we were required in order to come back in person, unless we had a specific exemption to get the vaccine.
Right. And they don't have a vaccine requirement now, and also I think one of the issues with the school committee or the schools with the vaccinations is that it was, the parents were filling out online surveys to let the school know whether or not their child was vaccinated, and not everybody was filling those out. So, and this was going back a month or so, but getting the data was difficult. But right now, the schools are, to my knowledge, they're not set up for remote. So it would be, I mean, they did it really well last year. So my guess is they'd be able to switch back with a little bit of notice, but it's not like flipping a switch. It does
Yeah.
take,
Yeah,
And I'm sure it's not ideal either. So,
not ideal for those working parents.
yeah.
Any parents.
and there is certainly COVID controversy to be found in town.
Yes.
I know a lot of people have not been following the Board of Health, but in the last couple months, the Board of Health has become the most popcorn-worthy meeting out of all the local government meetings. They have been bearing the brunt of the kind of anti-masker sentiment, and things got a little heated at their last meeting. And it's go watch it. It's really quite a doozy of a meeting. But they have a lot of questions to ask, and the challenge that they're running into now is that at the last meeting they were talking about the fervor of the anti-mask movement is potentially creating a bit of a public safety issue, and so now they're having to weigh the public safety issue of the anti-maskers against the public health issue created by COVID, and is it really worth having the mask mandate if they're creating all of these other problems by implementing it? And to that end, they actually lifted the minimum age on the mask requirement from, I think, age 2 to age 5, because people were livid about having to put a mask on their 2-year-old.
Yeah. I know some communities in Massachusetts have lifted the mask mandate already. So I live near Watertown. I live in Brighton in Boston. It's right near Watertown. Watertown is one of the places that have lifted it.
Mhm.
And I know obviously it's a controversial subject. So for example, at the State House, they were having a debate as well whether to do like a statewide or leave it up to the town, the communities. And there was an anti-mask protest actually that had the pleasure of attending.
Were a lot of people
to
there?
talk to people. Yeah, there's a lot of people, and I was interviewing people just for my school newspaper, which I do on the side. And yeah, it's definitely a controversial subject. It's a whole subject of its own.
Thanks for listening, folks. We hope this leaves you a little better informed about your town. If you like this episode, tell YouTube to share it with your neighbors by clicking on the like button, and tell us what you think about these stories in the comments. Thanks again to Nick for recording, to Kristi for joining us in the studio, and to Alex for telling us what's new in Westford.